In this video, I'm going to show you what hip trochanteric bursitis is using this model. Hey everyone, I'm Sebastian at Performance Play Sports Care, part of the locally world famous chiropractors in Costa Mesa, California. Now in this video, I'm going to show you the anatomy surrounding the hip and what it has to do with trochanteric bursitis. And also we should first start with, what is it? How does it feel? I just want to make sure you guys are watching the right video for you, because there's no point in wasting your time and watching a different video if you don't have the problems. So trochanteric bursitis, first off, is we have problems typically out here on the outer side of the hip. As I spin to the side a little bit, you'll see that I'm mainly able to pinpoint directly onto the bony bone right into that region there. Now this is the typical spot people will report trochanteric bursitis. Some people have been told they have it when they have groin pain in the front, pain that travels down the leg below this point, about mid-thigh. Some people have been told that their backside here, their piriformis muscle, their glute muscles, their upper glute in this region, or the SI joint, or even low back pain is associated with this. And quite honestly, they're not. Trochanteric bursitis is an inflammation or irritation to a bursa, which means that it does not travel into the area of the low back. It does not travel down the leg, past the knee, or into the inner part of the thigh. Now, with that being said, you could have another type of problem. You could have another diagnosis. In that case, we do have videos on lower abdominal pain, groin pain, or pain in the front of the hip. We have adductor strain ones. We have piriformis ones. We have low back and SI joint and so on. So if that is you, you may consider watching those videos next. Just go onto our channel and search. Now, as we look into this model, let's first get oriented. All right, we have, this is the right side of me. This is my right hip. And also, the bones in the area, this is the femur. Okay, this is the thigh bone. This is the ilium. This is where, if you were mad, you'd put your hand on your hip, right there. Okay. This is the ischium. This is the ischium here. Okay. And we have some of the musculature around the area too. The one that's glaring everybody right in the face, right in this region, is the most common one that people probably research when they have something like front of hip pain, which is called the iliopsoas. And so here's the iliacus, which blends in with the tendon of the psoas muscle, and they insert into the inner part of the femur, and it moves with the femur, which is why they're called a hip flexor. When they contract, they flex the hip, all right? And then we have the greater trochanter, which is the area of the trochanteric bursitis that we're talking about in this video. We also have some of the musculature on the back, and you can see this is kind of in the buttocks region, if you will, although it's kind of on the side of you. This is the gluteus medius. They've cut it, and then you can also see the other section of the cut down into here as it inserts into the greater trochanter. We also have the gluteus minimus, which it blends in with the same tendon. The bursa in question, the trochanteric bursa, is actually directly underneath this tendon here, and it helps out to actually create a lubrication system. I don't know if you can see right into here, you have the tendon and the muscle right in that area. And as I start to move the femur a little bit, there's a little bit of movement between the two structures. And so generally the bursa is an area that creates like a friction pulley. It's normal, it's normally occurring, and it helps you out. In the scenario where it actually hurts, there's a possibility that it's just irritated and enlarged. We also have some of the musculature in the back, things that you may have heard of as well. We have the piriformis muscle right into here. We have the superior gemelli, which is, there's part of its tendon right there. Then we have the obturator internus right here. And then we have the inferior gemelli right into this region here. You can barely even see it. These are some of your deep hip rotators. Now, the way to really resolve this problem is to make sure that the rest of the hip, and quite honestly, most of the hip musculature and anatomy not shown in this model is the most important, all right? Typically, the area here we can almost consider that bursa as being like an overuse injury, if you will. The theory is there's too much compression put on it, either externally, which is going to be like a bed, hard ground, or something of that nature, maybe even falling on your hip, or there's a possibility that the actual tendons and musculature are too tight, creating excessive compression on the bursa and chronic irritation. In this case, what you may want to do is actually make it so those muscles don't have to work so hard by making other musculature in the area work better, all right? Now, there's a lot of the terminology overuse injuries thrown around, and overuse injuries I think are a real thing, but I think if we reframe that into underutilization injuries, I think we can get a better picture of how to resolve this problem, all right? If you make the other musculature work better than the musculature in question creating the compression, some of the top muscles to condition in the area are the glute max, which helps out dramatically to stabilize the hip. But also, too, we have to take it a little bit further backwards. We need to make sure that the pelvis and the core work well. And what that includes is the front core, which is your belly, the side core, which is your obliques, let's just say, and then we have the back core, which is your QL muscles, paraspinalis, and so on. But also what matters is the top and bottom of the core, which is going to be the pelvic floor, and then there's the diaphragm on top, which goes from the thoracic cavity. When you rehab the area in this fashion, what you're accomplishing is good core and pelvis stabilization, which allows the hip and glute max and some of the other musculature to work better, essentially cooling down the overuse aspect of the problem. It cools down the bursa, and it also makes it so things don't come back quite so fast. Now, there is a very valid way of reducing pain associated with trochanteric bursitis, and it's quite honestly rest. We see a lot of people who feel much better when they just rest it for a couple days or even a week, but the problem is a lot of times people, when they go back into their old activity, it tends to come back again. With that being said, you should be considerate that you possibly have not rehabilitated the whole problem. You've just reduced the pain, and pain management is very simple. Don't use it. But also, if you don't use it, you lose it. So really building up a good rehabilitation program is the perfect answer for this scenario. If you guys are looking for help, we have virtual help and in person, and we can customize some of the exercises and stretches you should be doing to solve this problem. We see many people with low back, SI joint, groin issues, and bursas just like this in the hip. We specialize in that core of the body. And quite honestly, you cannot rehab a hip alone. You have to do it within the pelvis and the core too. You have to rehab the quarter. So if you guys are looking for help, reach out to us. We'd love to help you out. See you next time.